living is made up of real-life stories from very real people, whose identities and circumstances have been concealed. These testimonies were shared in order to inspire others to seek prompt solutions to their fertility issues.
Choose wellness. Choose health and vitality. Know your numbers.
This is a corporate social responsibility message from Pathcare, Nigeria's foremost pathology laboratory.
Life and Living series presents The Latecomers.
Good afternoon, Mama. Good afternoon, Papa.
Adesua, my daughter. Koyo, you are welcome.
How is work?
We thank God. I brought some foodstuffs for you.
Oh, sir. Oh, thank you, my daughter. You are really good to us.
If you are really good, you will bring us husband instead of food.
Papa. Emata no. Your father has a point, Adesua. Your junior sister is getting married in 6 months. Are you not feeling it, Adesua?
God's time is the best, Mama.
Which kind of God's time? Your junior sister is getting married before you, and you are there saying God's time. You are now 27 years old. When your mother was that age, she was on her 3rd child.
My daughter, Lawowo, please don't put me to shame, Adesua.
I've heard, Mama. I've heard.
Now, wow, your parents are really on your case, Adesua.
I'm just tired. Because of this, I don't like going to see them anymore.
But you know you could have married a long time ago if you really wanted to.
You're talking about Mike again. Osaitin, I already told you he wanted sex before marriage.
Adesua, this your religious stance is not helping you. This is the 21st century, for crying out loud.
God's standards never change. I don't care what century we live in.
Okay, good luck.
Good afternoon, Adesua.
Hello, James. Osaitin, this is James. He just got transferred here from Kaduna branch. James, this is my friend and colleague, Osaitin.
Oh, pleased to meet you, Osaitin.
Same here, James.
Well, Adesua, it is lunchtime and I don't know where to get good food. And you promised to show me around.
Oh, really? I didn't know Adesua is now a tour guide around here.
Don't mind Osaitin. She likes to tease. I guess we could all go to lunch then.
Oh, good.
Okay.
Please, just give me a moment. Let me get my car keys.
All right then.
Okay.
Wow, Adesua, you have been holding out on me.
What are you talking about?
See that fine guy you are keeping under wraps. So should I start saving for Ashwebi?
About Osaitin. I just met the guy.
From the way that guy is looking at you, I sense wedding bells.
Osaitin.
Thank you. Can I have everyone's attention for a moment, please?
Okay.
Thank you. All right. I'd like to once again welcome you all to the union of James and Adesua. I've been friends with James since we were 5. And I honestly thought he was going to be a reverend father. Yeah, because he had no interest in girls. But now I see why he waited so long to get married. He was waiting for his soulmate, Adesua.
Thank you.
My children, you are welcome.
Thank you, Mama.
This is a surprise. We were not expecting you till Christmas.
No. We have to check on you from time to time. Oh, before I forget, there are foodstuffs in the car.
Oh, my daughter, God will bless you. Although I thought by now we should be seeing the early signs of...
Mama, the time for that will come.
In that case, God will replenish your pockets double-fold.
He said.
May you be blessed with the fruit of the womb before the year is over.
He said.
Thank you, Papa.
Is anybody in this house?
Uncle Osa?
Adesua, you're here?
Yes, my husband and I came to drop some foodstuffs.
Good afternoon, sir.
James, it's good the two of you are here. We can all discuss this problem together.
What problem?
How can you be asking me what problem? How many years have you been married?
Uncle, please, not that again.
My daughter, keep quiet and listen to what your uncle is telling you. We are the ones that sent for him.
We have watched you for the past 5 years. Every year, you bring foodstuffs. But when we ask you about children, you tell us to be patient. How much longer do you want us to wait?
Exactly.
I mean no disrespect, sir. But you can't just come into our house and tell us what to do.
And
who gave you the wife? And the same way we gave you is the same way we will collect our back.
What?
Stop it, all of you. James, let's go. We won't come back here until everyone comes to their senses.
Adesua! Osanobwa! Come back here and let us find a solution to your problem, Adesua!
It's okay.
I am really getting tired of everything. The pressure from my family to have a child is killing.
Adesua, I feel you. You know how much value our society places on children.
But I can't create children. What do you want us to do?
My friend, have you sought any medical attention?
Are you saying I don't have faith?
No, I'm not. But if in 5 years you haven't sought any medical attention, then where are your works? Remember, faith without works is dead.
Osaitin, don't join them.
Adesua, you're just 32 years old. Your chances of getting pregnant are still on the high side. Why not get some medical help?
Osaitin, I think you should leave now.
Hello, baby. What's up?
Your mother is here. Huh? Did she tell you she was coming?
No. What is she doing here?
She said she came to greet me.
Okay, I'll be there as soon as I can, huh?
Please hurry, please.
Okay.
Adesua, my daughter. That meal was delicious.
Thank you, Mama.
Sit down, my daughter. Let us talk. I know you are surprised to see me here, huh? All the way from the village.
Actually, I am.
Adesua, you are a very good daughter-in-law. I could not have wished for a better one. But we have to do something about this situation.
You mean the fact that I haven't gotten pregnant yet?
Adesua, it's been 7 years. We still can't be talking of yet. The family has decided that James must take a second wife.
What? Oh, Mama.
Take it easy, my daughter. That is why I'm here. I know that you will not want us to bring in another wife just like that. That is why we want you to be the one to choose a wife for your husband.
You want me to pick a second wife for my own husband?
It's better you carry your own hand to pick a woman that will not give you problem.
Oh, Father in heaven. Osanobwa, what is all this?
Adesua, baby, please stop crying. I've told you there is no way I'm ever going to take a second wife, huh? It's okay.
They are not asking for your permission, James. Your family is going to bring another woman, whether we like it or not.
Adesua, I made a vow before God and man to love you.
Then why won't you agree for us to get medical attention?
Adesua.
I've been saying this for the last 2 years, but you wouldn't even listen. Do you realize the older I get, the slimmer my chances are of getting pregnant?
Adesua, that doesn't sound like you have any faith.
James, maybe it's time we backed our faith with some action. There's this highly recommended fertility clinic we can go to.
Honey.
Oh, darling, welcome.
Thanks.
You're home early.
Yes, I went to get the results of the treatment we did at the clinic.
Really? What did they say?
Well, I haven't checked it yet. I wanted you to open it first. Here, go ahead and open it. Adesua, why are you throwing it away?
I failed.
What?
The result is negative.
Are you sure? Let me see. Hey! Adesua! This isn't negative, it's positive!
What?
You didn't look at it properly. You're pregnant!
I'm pregnant!
Yes!
Oh, thank you, Lord!
Thank you, God!
Was that a what?
Yes!
Thank you, God!
Oh, come here!
Welcome to Life and Living. With us today in the studio, we have once more the famous Dr. Ajayi of the Bridge Clinic. You're welcome.
Thanks for inviting me, Dr. Pamela.
James and Adesua seem to have found the perfect match in each other. It seems a shame that they seem to have run into problems. Why is that?
Well, infertility is quite a common condition. It's difficult to have precise data, but estimates suggest that 1 out of every 4 couples in Nigeria would experience some challenges with achieving a pregnancy. Now, infertility technically is defined as the inability to conceive after 1 year of regular, unprotected sexual intercourse. But in their case, they waited a bit longer than 1 year before seeking help.
What are the causes of infertility?
For the benefit of our audience, I like to break it into very simple terms, such as to achieve a pregnancy, you need good quality sperm, you need good quality eggs, the sperm and the eggs must meet, and the uterus must be in a good enough condition to develop the fertilized egg. So you can say problems with the sperm, problems with the egg, problems with the fallopian tubes, or problems with the uterus.
Now, in this particular case, we can't really tell why they had infertility, or can you deduce it from the story?
No, it's difficult because I think the case did not give us any specifics. But the interesting thing, of course, is that infertility can be caused by any of these 4. So the cause could be either be in the man, or it could be in the woman, or it could be in both of them. So from the data we have, it could be in the man or the woman or in both of them.
Now, would you say that infertility is more common here in Nigeria than elsewhere?
The evidence suggests that the prevalence of infertility is double of what we will see in more developed countries.
Why is that?
There are many reasons. The most common cause of infertility in Nigeria is tubal infertility. And the most common cause of tubal infertility is infection, usually secondary to infection from either operations, sexually transmitted diseases, consequences of abortion, consequences of a miscarriage. So pelvic infection is a very common cause of infertility in Nigeria. It could also be secondary to operations of the pelvis, such as a lot of women have ovarian cysts that are operated on, or fibroids. Because of the poor quality of our general medical infrastructure, the complications of this operation are quite common in causing infertility. So that's one side.
Is it true that a person could have infertility secondary to appendicitis?
It's not very common, but the association has been reported, especially if you have appendicitis that ruptures and causes severe peritonitis, which is severe inflammation of the pelvis. It's been reported to be associated with infertility.
How can you make a diagnosis of infertility?
Well, the diagnosis of infertility, the history is one. If you're not able to get pregnant after 1 year, then you need to do tests, and the tests are to test the quality of the sperm. You need to do a semen test where the gentleman produces a semen sample. usually by masturbation, and this is examined under the microscope to see whether it meets the normal standards. Then we need to test if the woman is ovulating. Usually if a woman is having a period every month and it's regular, then we're sure that she's ovulating. But at the same time, we need to test in a good quality laboratory, such as PathCare, to check the hormone levels. Then we need to look at the fallopian tubes. Now, fallopian tubes is quite invasive to test, but the best and easiest way is to do a good hysterosalpingogram, which is a special X-ray called HSG. And the fourth thing to check, of course, is the uterus. I'm sure the uterus can carry a pregnancy. An ultrasound scan is a good screening test for this. And once you carried out all these tests, you can come to a diagnosis to say this is the problem and this is the solution.
What solutions are there for people who have infertility?
Well, if the cause is an ovulatory problem, such as woman is not producing eggs, then there are a lot of very good medications that we can use to bring on ovulation. But I need to say a little bit more about ovulation, because the fact that you have a blood test result that says you have ovulatory problems, really, in my experience, doesn't mean you have ovulatory problems. It's also to do with the quality of the testing. For example, a lot of patients come with high prolactin, which suggests that you have hyperprolactinemia. But prolactin is a very difficult hormone to test. So if you don't go to a good lab where they do the test properly, a lot of people have what we call spurious hyperprolactinemia. So your prolactin is actually normal, even though you have a blood results that say it is high. So one has to really be careful. But having made a diagnosis from a good lab, then you can give ovulation induction treatment to bring on the eggs if they're not coming out. Sometimes you may not even need to give them treatment. You may just need some dietary advice, because excess weight can cause ovulatory problems, as can low weight. So dietary advice and weight reduction or increase in therapy may be required.
That's interesting, because people feel that if they go to an IVF clinic, they must have IVF done. So there's a wide range of treatments that are provided in clinics.
Oh, absolutely. But the truth is that, when I talk about ovulation problems and sperm problems and all the minor causes, most people with these causes would achieve a pregnancy quickly. So by the time you've waited and you've been having treatment for 3 to 4 to 5 years, most people with infertility of that duration unfortunately will need IVF.
So when is the optimal time a couple should seek help?
Well, as soon as you know what the problem is. If you've been trying for more than 1 year, then you need to go and get a diagnosis. But you don't need to wait for 1 year if you have problems. For example, if you know you've had ectopic pregnancies and you've lost your fallopian tubes, or if the woman's age is over 35, where we know there's an age-related decline in female fertility, then you need to seek help earlier than 1 year. But once you've gone to the hospital and they've made a diagnosis, then I think you need to get advice on what the best thing to do should be.
Now, the truth is that a lot of people don't want to do IVF. There are a lot of questions, and they say that IVF is playing God. Is that true?
Well, of course. It's very difficult. People don't like IVF because everybody wants to get pregnant in the privacy of their bedroom, and I think that's natural. But of course, if you're not achieving a pregnancy by yourself, then IVF is a great idea and it's one that should be embraced. You can't wish it away. It's a good treatment, it works, and so if you need it, then I think it's important to face that. I always give the analogy of someone with bad kidneys or a bad heart. Nobody wants a renal transplant until you need it. Nobody really wants IVF until you need it, and if you need it, it's there and it works.
Thank you.
Thank you for inviting me.
If you'd like to get in touch with the doctor, you can send an email to doctor, which is DOCTOR, @thebridgeclinic.com, or text Fertility Lagos to 20050. Thank you, and stay tuned at the same time on the same station next week.
Choose wellness. Choose health and vitality. Know your numbers.
This is a corporate social responsibility message from PathCare, Nigeria's foremost pathology laboratory.
Life and Living series is produced by Verdant Zeal for Doctors on Air.